This is our patient Bartholomew. He is at risk of ischemic stroke. Bart has an extremely stressful job resulting in hypertension. He also has diabetes mellitus and atherosclerosis and smokes frequently, which greatly increases his chance of having an ischemic stroke. Bartholomew struggles to keep his hand in the air to wave goodbye to his coworker. This is due to sudden weakness and numbness to the right side of his body. Weakness can also persist in the face and legs as symptoms of stroke. Other symptoms include sudden confusion, difficulty talking or understanding speech, vision problems, dizziness, loss of balance or coordination, trouble walking, or a severe headache.
Help! Someone help! We need to call 911 and act fast!
This is what's happening to our patient. He is experiencing an ischemic stroke. An ischemic stroke is caused by blood clots in the arteries. This restricts blood flow to the brain, causing cerebral infarction and possible death if not identified quickly enough. The areas most commonly affected in the brain are the primary somatosensory cortex, thalamus, and the medulla, all of which are along the dorsal column medial lemniscus pathway, which is where strokes most commonly occur.
Muscle spindles are stretch receptors that detect muscle length and rate of stretch during voluntary movements. Muscle spindles are embedded parallel with extrafusal fibers, and they regulate contraction of muscles. During muscle shortening via activation of motor neurons during the stretch reflex arc. Without muscle spindles, muscles would go slack during voluntary muscle contractions. Deficits in the brain, specifically during stroke, may result in changes in background discharge rates, which can cause motor functions to be impaired. However, responses to reflex inputs and responses to voluntary contractions do not change. Sensory neurons in the brain tissue communicate with other cells to form functions including memory, speech, and movement. When a stroke occurs, the muscle spindles get injured, and as a result of this injury, these cells cannot communicate properly and functions are impaired. If a stroke occurs on the right side of the brain, the left side of the body is affected and vice versa. We would expect muscle spindles to be affected in individuals with stroke as they control the lengthening of muscles, and strokes cause weakness, loss of dexterity, and problems with the reflex response to proprioceptive and cutaneous stimuli. The muscle spindles should behave abnormally or have no firing rates at all, but patients with stroke are still able to move and respond. They just cannot interpret any proprioceptive information that is received and are unable to sense where limbs are and how much force, amplitude, or speed is being used.
Ischemic patients have presented signs of altered nerve conduction. Strokes can result in neuropathic symptoms in the peripheral nervous system of the affected side, along with impairments in the vasomotor function. Research suggested that the extent of degenerative change in the paraneal tract was closely related to the severity of the motor deficit. The severity of the hemiparesis depend on numerous factors such as age, other neurological deficits, illnesses, and the onset of strokes to the time of treatment. There are many questions that remain unanswered about strokes. As such, treatments and preventions are limited. There are two types of approaches aimed at reducing the outcome of ischemic stroke. The first primary prevention relies on the changing lifestyle to limit risk factors for ischemic strokes in asymptomatic populations. The secondary prevention approach is designed to reduce the recurrence of ischemic stroke. The only acute therapy approved in ischemic stroke is intravenous recombinant tissue plasminogen activator, RT-PA. The primary function of TPA is to catalyze the conversion of plasminogen to plasmin, the primary enzyme involved in dissolving blood clots. Recombinant biotechnology allows TPA to be synthetically formed in labs to produce recombinant tissue called plasminogen activator. The recommended secondary prevention strategy varies with the subtype of stroke. It is important to establish the most common subtype for ischemic strokes, since the diagnosis influences the process of selecting the best measures for secondary prevention. For example, a large artery atherosclerotic stroke in the extracranial internal carotid might be treated best with endarterectomy and antiplatelet drug, while a cardioembolic infarction is best treated with anticoagulants.
No Bartholomews were hurt in the making of this presentation.
Thanks for watching!